Hi there, my name's Sarah, aka Josie, aka JD, and welcome to Trickle Down Therapy. Now, in this episode, I'm going to be explaining something very near and dear to my heart as a chronic pain patient. You may have heard of spoon theory somewhere on the internet. This is a concept that is widely used to explain expenditure of energy levels in patients with conditions such as depression, executive dysfunction, and chronic pain and chronic illness. It was originally developed as a visual way to explain how a person experienced lupus. However, it's come to my attention that many others like me never really clicked with spoon theory. Sometimes I prefer more practical explanations, and from talking about this on the internet, it seems like I'm not the only one. So for those of you who don't understand what spoons have to do with disability and mental health, here's what I call the gasoline theory. Imagine that you have $50 to get you through the week. For a lot of us, that's a reality, but let's pretend this has nothing to do with the quality of your job right now. Because of how you were born, totally out of your control, you only have $50 to get you through the week. And what's a week in this example is like a day in real life. Every day, even. Now let's say you spent $10 on groceries for the week, and you know you need at least $25 for gasoline to get to and from work. If you don't get to and from work reliably, you'll lose money, maybe even your job, then your apartment, your health insurance. You could die. At the very least, if you don't have that money for gasoline, it will mess you up for the immediate future. You can't get around if you don't have that money. Now imagine someone asks you if they can borrow 30 bucks. Maybe your friend, your roommate, coworker, family member, whoever. These are all people who are constantly begging us for what little energy we have. That would only leave you with 10 bucks left, and you know for a fact that you're going to need 25. But the thing is, this person knows the money's in your account. They can see the $30, but they're not thinking about the fact that if you give it to them, you'll screw up not only this week, but the next, possibly even spiraling further than that. You literally could let them borrow it, and maybe they do need it, but it would completely mess you up. You know you cannot spend it. They often don't care, though. They just see what you could do for them and don't comprehend just how much gas it takes to get to and from work. Then they get angry with you. They call you selfish and lazy. And even the people who do care that you can't spend that money will eventually come around to saying, there's no way you always only have 50 bucks. And because the pain is chronic, nearly every week or day in real life, someone somehow needs to borrow $30. And for some reason out of your control, you really do always only have 50. And sometimes you inexplicably wake up with only $5 in the bank. You don't know where the money went or why. You just know that this happens often enough to just grit your teeth and struggle through when it happens. You've accepted that it's a part of life. That doesn't make it easy, but it breaks any kind of spirit that would normally say you could find a way to fix the problem. And you still have to get to work anyway, so you plunge your bank account into the red. You'd give anything to stay at home and lie down. You're truly just trying to survive the week, and sometimes you're not sure that you will. And then your roommate screams at you for not doing the dishes. Truly one of the only things you can do for yourself when chronic pain gets severe enough is lay in bed. Sometimes the only thing that will reset your pain levels is a solid night's sleep, and you can't force that. A nap in the middle of the day isn't going to give us that kind of recovery rest, and it's worse for people with insomnia or delayed sleep phase disorder. Plus, I think it's worth noting that a defining symptom of fibromyalgia is that we sleep much lighter than others uncontrollably, which contributes to our constant pain levels. So when all of this makes it so that you can't help your own pain levels without getting lucky with a deep sleep, you know you have to ration out your energy until the next full night's rest. And for a lot of us, it takes years of misery to be able to understand and articulate this. So we feel terrible and we can't express to others that if we clean our bedrooms, we won't have the energy to make dinner. Or if we're disabled kids, do homework. So our health further suffers as well as our grades. When we don't have money left over for the fuel to cook healthy meals, we end up eating a bag of chips for dinner, which feeds into our low energy levels, and the lack of nutrients can cause worsened chronic pain. For grade school and college students whose conditions aren't properly understood by their guardians, they're often forced to do chores and extracurriculars, and the energy burned up in these activities impedes on their homework. Then their grades slip, their mental health follows, and their parents often punish them by taking away their only reprieve in the form of electronics and socialization. Then their mental and physical health slipped further. I want to clarify that the point of this video is not to say that people with low energy levels should expend as little as possible. Often with conditions such as depression and executive dysfunction, the only way to get energy is to give energy. If it's a mental health issue, changing your habits to put in a little more effort toward feeling fulfilled and productive is almost always far more helpful than doing nothing at all. And it is good to expend energy toward helping your chronic pain in small increments. Stuff like walking, biking, even water aerobics has been known to ease chronic muscular and joint pain. However, not all chronic pain is in the muscles and joints. Some of us have barely treatable nerve pain, and if you're like me, chronic headaches and migraines that can't just be exercised away. The most helpful advice to come out of this video would be to learn your limits and how to communicate them. Or if you're an ally watching this video to better help your disabled loved one, to put a little more effort into understanding what they go through and to help them learn to communicate how they feel. Set up a system where one lets the other know what chore needs to be done, and the other lets them know that it may take a few days, but they are trying and they do intend to get to it. And maybe even plan out which chores each person will take based on which ones will cause the least detriment to the disabled person. To my fellow disabled people watching this, you really do need to do some chores or cooking every now and then. The feeling of capability and self-sufficiency can drastically help your mental health and motivation levels, and you do get more energy out of it once you're a little more used to expending it willingly. As always, don't forget, those ideas of doing nothing but eating chocolate in bed all day as self-care are at best dangerously misguided, even stepping over the line into anti-recovery culture. Doing nothing all day is rarely ever good for you unless you're in debilitating pain or extremely sick. It will make your energy levels worse. So try having a little compassion for each other and understand that as a disabled person, the ability to understand and ration your energy levels properly is crucial to happiness. Don't push your disabled loved one too hard, and if you're disabled, don't do nothing at all. It never has to be one extreme or the other. Learn yourself and love yourself. And make sure you have enough gasoline to get to work. If you have any questions about this topic, feel free to leave a comment on this video or come chat with me on my Patreon at patreon.com/trickledowntherapy. Like I've said before, you're going to get access to all the same videos there that you will here, so it's not necessary, but appreciated. You can also leave a comment on this video if you think of another topic you'd like me to discuss, but bear in mind that I'll only be covering topics I'm comfortable in my knowledge of. Thanks for watching! I hope it helps.